Broadcast is now starting. All attendees are in listen-only mode.
Hi, everyone. Good afternoon. Thank you for joining us. This is Eric at State Office. Before we get into today's session, just to let you know a few housekeeping things. First is that we are recording today's session, and we will send out the link as soon as it's available, probably tomorrow, but no later than Monday at the latest. A couple of other quick items. This is the first in a series of 3 presentations that we are holding regarding the future of our programming as it relates primarily to day services and what they will look like. So we have today's session on community habilitation on July 7th. We are going to have a session on self-direction, and then again on July 14th, integrated day services. And we will be sending out the information and registration links shortly, probably either today or tomorrow. So that being said, I want to leave as much time as possible for questions at the end. If you do have questions, there's a chat, or there's actually a question box in your GoToWebinar dialogue box. You just need to enter it in there, and at the end, we'll try to get to as many as we possibly can. So all that being said, I am really thrilled. We reached out to Mary Howard, and she had informed us about a kind of an innovative community habilitation model that they were using to help supplement the day services. And Mary was kind enough to link us up with 2 of her key staff, Mary Ellen Gengemi, I hope I'm saying that correctly, who's a behavioral health service manager, and Amy Capel, who is the Director of Behavioral Health Services. So I will turn it over to Amy and Mary Ellen, and we'll get started.
Okay, this is Amy. Thank you, Eric. Amy and Mary Ellen here. Just going to share some of the program operational lessons we've learned along the way with the ComHab program. Some of the steps we take that make it fiscally sound, and I hope it's helpful. Thank you for joining us today. The first, next slide, please, Eric. The first aspect we kind of want to look at is the budgeting. We have, no matter what the method of budgeting the agency as a whole used, some things we've really discovered is with these community programs and ComHab, looking at the actual units to be provided throughout the year annually is really a key to get as accurate as possible. That way you're looking at truly the revenue that the services will bring in, and then it gives a really good clear picture of what the goals are for the program for each month, and we can monitor it throughout the year to make any adjustments that are needed. So when budgeting, regardless of the overall method, looking at the actual units, we found is really a key part of that. Then to connect that to the program, we really do hold both the management and the service staff accountable for meeting those budget goals. We're in constant collaboration and educating the staff, looking at where we are month to month in meeting the budgeted units for the program, and looking at all the factors that a lot of the factors we'll look at in the rest of this presentation, but really having a lot of discussion and collaboration program-wise to make sure that we're meeting those budget numbers. Along with that, that gives us kind of an idea of the units, give us an idea of the revenue coming in. We then look at the operational parameters for the program and really we work with our fiscal analysts to look at the program costs and operational parameters to see where the tipping point is for cost versus revenue. again, go back to the actual number of units versus staff costs and administrative costs, program operational costs, and really trying to get an accurate picture of that from year to year, as well as making adjustments for any factors that might come out of nowhere, such as what we're dealing with this year, as well as, in New York, we have weather, we have, all kinds of aspects that impact the community programs. This last point, the staff productivity is something that we have put in place. And again, we can monitor this as the program operational factors. We can monitor this almost daily. And we do look at it monthly at the very least with our fiscal analysts. And basically, we really break down and continue to monitor the percentage of time that our staff work for their work week, but then also the percentage of billable time that is within that work week. And we set productivity goals. So like if you have a 40-hour work week and we have a 50% productivity goal, we would want to make sure their caseloads and scheduling and their service provision is billable time, at least 20 hours of those 40 hours within their work week. So we work with our fiscal analysts to determine those and really keep a close eye on what that looks like. Again, we can look at that weekly, we can look at that monthly, and we monitor that throughout the year to see where we are in hitting our overall annual goals for the budget and service provision. So that's a big key in our monitoring overall for the fiscal sustainability of the program. And our fiscal analysts, we can break that down for the program as a whole, but then we also can look at each staff based on their caseload. So we might look at each staff, their productivity rate, and then it gives us an idea of any adjustments that we can make. That productivity helps us with ongoing budgeting and planning throughout, like into the next year. Any adjustments that we've made, anything that we know is coming up that we need to make adjustments for, that data really helps us kind of plan and see where we might need to make adjustments to maintain the fiscal sustainability of the program. So that's one of our big keys with our fiscal analysts that we do for the program ongoing. Next slide, please, Eric. Okay, for caseloads and scheduling, we start right off the bat at the life plan meetings to work on scheduling individuals, talking with them about their availability. Are they available Mondays, Wednesdays? What does that look like? Which day of the week? The time frames they're available. And then, so that kind of right off the bat starts that conversation of availability and consistency. We do really work hard to establish a consistent schedule so that we know we're meeting with an individual every Monday at 1 o'clock for so many hours. That's in contrast to like if you were to go, when we go to the doctor, if we go one day at the end of that visit, doctor's visit, we then schedule for the next visit. We really found that wasn't very helpful, and it wasn't helpful in maintaining the same sustainability of the program because there wasn't consistency, and there were more sessions and service times that were not met because there was not a consistent schedule. So right off the bat, that's one thing that we learned is if we can get from right at the get-go a consistent schedule for the individual that we know ahead of time every day of the day of the week and the time that we're meeting with them, then that just maintains the consistency for the program in scheduling and the service provision, and that goes right into meeting those units for what we budgeted for the program. Let's see, staff. We right off the bat established the staff schedule. The supervisor is very involved with that, as well as the individual and the family, again, right from the get-go. And then we up front, on the front end of the service provision, the staff have specific schedules. So we know what the service provision time, billable time is in the staff schedule versus their overall work time for the week. We know ahead of time what that looks like. And if there are any variations to that, that's done in collaboration with the individual, the family, the supervisor, and the staff. So again, that helps us with our ongoing monitoring of that productivity, the service provision. It helps us catch if there are any concerns that the family has, you know, any of the dynamics that go into working and doing a community service. We catch them right off the bat because we have that collaboration set up right up front. So that really does help us monitor that productivity. It helps us maintain that collaboration and the family having a say in what they need for the service to be able to give and provide a quality service, as well as maximize the service provision that we're able to give them. So that collaboration, any changes to the scheduling are made with the supervisor. I mean, we have found that that's a huge key. And again, a lesson learned for us, that it's not just the staff out there making any adjustments as they go along in their week. The supervisors in that mode of in the know of what's happening, so that we can address anything that needs to be taken care of for that. Some of this also helps with the awareness of what other programs the individual might be participating in. So if they have a vocational program or some other programming that they're in, it avoids overlaps, which again, when that wasn't happening, we would have an overlap of service and then you couldn't bill because there's an overlap, or you would show up for a service and they would be involved in another service. And so there's that eats into the productivity and eats into meeting those service unit goals that for the program that's budgeted. So having that awareness of any other programs the individual's participating in, again, that collaboration is huge for the other service providers. We do that, you know, right from the get-go at the life plan meeting, and then ongoing with the case coordinators, the other programs, the staff, and the supervisors involved in all of that discussion. The other thing that is key that I think we do is we have an ongoing dialogue with the staff and individuals and the families about the scope of the service. So it doesn't just get stagnant looking at a single or a couple goals. We really continue to have a dialogue about the scope of the service, what are they getting from the service, any progress that they're making, opportunities that are available to them through the service. And we have found that this really promotes them having some ownership of their role in the service. So they're getting this service for, you know, whatever skill development, whatever community linkages that they're working on. And it really seems to maximize their participation because they have an understanding of what the service has to offer, what opportunities are available, and it really does, you know, point them towards that person-centered and them having ownership in the service that they're getting. And the same thing with staff. We really have an ongoing dialogue with staff of what are the opportunities that we're able to provide the individuals. How do we continue to make this a quality service based on what the individual's needs are, and the full scope of the community HAB service. And that does help maximize participation from the individuals. And like I said, gives them a buy-in and ownership for the service. So I think that's something that has really helped us with the engagement of staff, the engagement with individuals and families, and I think helps provide a good quality service. The last point on there, the program, we offer both full-time and part-time employment status to allow for flexibility for staff. This has increased our staff retention for the program. We do have a pretty good if you comparing to other programs, the challenge of staff retention that we see across the state, the ComHab program does have a pretty good staff retention rate, and it does minimize the cost of staff turnover. When you can retain the staff, it does minimize that cost. So if you can minimize that cost, it's definitely more sustainable because the revenue coming in is able to sustain the program without that extra cost going out. So we have made it flexible, both part-time, full-time employment. And again, based on the productivity and all those other factors I mentioned, we've been able to offer both employment statuses. Next slide, please, Eric. All right, documentation. The daily note for these sessions, we have the staff complete them with the individual at the end of each service provision, at the end of the session. We have found this really has helped our documentation be more person-centered than it was previously. It provides the staff with immediate assessment of what did the individual accomplish or gain out of that session towards their goal or objective. It really does help capture the individual's voice in the process, which really helps, again, keeps it from getting just stagnant around a goal and keeps it really that buy-in from the staff and buy-in from the individual to see, like in the moment, what they learned, what they accomplished, and then also continue to look at what they need to continue to work on, what their goal is ongoing, what still needs to be attended to in ongoing services. So that piece of it, the staff being able to do their daily notes in the session with the individual really has helped us capture, I think, some more of that person-centered and the individuals and staff's that ownership of the quality of service. Notes, we have them turn them in weekly, and they are reviewed weekly. Again, this allows us to really, on a weekly basis, know that the services on that staff caseload were provided. We have the documentation. It was completed on time. We can then take that data of that billable service time, goes back into those productivity numbers that we're able to look at and monitor ongoing in real time to know if there's any adjustments that need to be made. We also have, the reason we do weekly also is because it's a community program, it eliminates staff having to come into the office daily, which eliminates some of the staff costs of doing the non-billable type roles that staff have. So we have them turn them in beginning of every week, and that has really helped kind of alleviate a little bit of that cost and increase the productivity amount that offsets the cost based on the units provided to meet our budget numbers. We also have found that setting real clear timeline requirements for documentation is real important so that staff have clear expectations. We follow up with staff. If they don't get their notes in during the week, we're right there calling them, saying, where's your paperwork? What's going on? It gives us an immediate feedback of staff meeting the expectations of the documentation and the program having the documentation that's needed for the service provision. So setting those real clear expectations for staff and then following up immediately if they're not met. And then we also follow up with the staff that are meeting them and acknowledge that. And I think that's important that we do both. In staff meetings, we'll acknowledge, the folks that got their getting their paperwork in and their documentation in and acknowledging both sides of that. So, all right, next slide, please, Eric. Great. Travel and mileage. Caseloads, we really try to develop caseloads based on an area of proximity. Because we have such a large catchment area across the county, we're in a rural county, that there's a lot of travel involved in order to get to the individuals that need the services. So we've really kind of brainstormed and done some things to kind of minimize that travel and maximize the amount of billable time that staff are able to spend with the individuals, as well as it maximizes the number of individuals we're able to provide services to. So that all kind of dominoes around this travel and mileages. So the caseloads, we really try to keep, if we have a staff in a certain area of the county and we get a referral for somebody in that certain area of the county, we really try to match up any staff that are in that proximity, adding that individual to their caseload, and then they can maybe, you know, capture that individual on the same day that they're in that specific area of the county. So really looking at caseloads based on the area of proximity, and then also looking at the same direction of travel. So if we have a staff going out to the edge of the county and we have a referral for somebody that's on the way to that other individual, then we'll assign it to that staff that's on the way. So they're traveling, they can travel in one direction, go meet both of those individuals on the same day, and we're minimizing travel and maximizing the amount of service time that we're providing. So we really do look at those, the direction staff are going, the starting point for where staff's day is. We take that into consideration rather than have all the staff come to the office and start from the office. If we have a staff that lives in a different part of the county, it's more beneficial for them to go from their home right to the individual's home where they're providing the service. So if we have staff that live in the upper corner of the county, we'll try to assign them the folks that live up in that corner of the county. So again, it just minimizes that travel and that mileage, and it maximizes the number of individuals we're able to provide services to, and it maximizes the time that we have available to provide actual services for the program and for the individuals. So we really develop caseloads with these factors in mind. We'll look at them closely to see, and we balance that with, you know, making sure the staff's a good fit for the individual. If it's an individual that needs a male staff or female staff, well, you know, those are all considerations as well. So you're kind of balancing those things out, but we really do try to watch and have staff go to specific areas within either the direction of travel or the close proximity of where all of their folks are. We only have staff come into the office once a week to drop off their paperwork, and the ongoing communication with staff, a lot of it is by phone with the supervisor or emails. So there's ongoing support and supervision throughout the week. We just have the staff come into the office once a week. Again, that minimizes the time that staff are coming into the office. If they're coming into the office 3 and 4 times a week, that creates more time that they don't have available to do billable services, to meet the units and provide the service to the individual. So we have a once a month face-to-face staff meeting. So again, that's just once a month that staff come in to meet. We have we can provide supervision to staff by phone, email. Now we have Zoom, been using Zoom for some. So we're getting used to all of that. But it really does minimize the time that staff, you know, need to come to the office. So we schedule and complete the maximum service time needed for the individual to offset as much travel as possible. So what I mean by that is when we plan service time, if it's a 4-hour service time, we want to plan that service time to meet the needs of the individual, to work on their goals. We want to do it in that 4-hour block. rather than splitting it up into like 2 hours on different days. If you do 2 hours on different days, you're traveling both days, and it decreases that productivity number, that percentage for the staff and for the service. So if at all possible, we want to provide that individual with a maximum service time on a given day to, again, it maximizes the time we're able to spend with that individual and provide the actual service. So we keep an eye on that. Now, if it's needed, if the individual needs a day with more time, we're flexible with that. If there is, they end up getting another service and we have to flex around that, we'll do that. Again, that goes back to that ongoing collaboration with the supervisor, service providers, the individual, and the family. But we really do try to maximize the service time that we provide when we travel there one day, so that we get the productivity increases. Go ahead, Mary.
I just wanted to add too, it's beneficial for the people that we are supporting, because if some of them are so far out, there really isn't much around there that they can reach. And so the more time that we're able to spend with them, we could take them to a Walmart, or we could take them to places that they need to go. And this way, it maximizes our time and their time, and they're able to do more. If they're out there for 2 hours, there's not too much you can do when it's an hour travel time. Thanks.
Yep. So, all right. The other thing we do with each staff is assess the cost of paying them mileage versus the use of an agency vehicle, and this can vary based on all of the above things I've talked about. The proximity area, if the staff lives near where our agency vehicles are, it's easier for them to use an agency vehicle. We look at the amount of miles that staff is traveling. We use our fiscal analysts again, because there will be a tipping point of we're paying staff mileage, but at some point it becomes more cost effective for them to use an agency vehicle in what we're paying for the agency vehicle. So we look at that, whether it's 20 miles, if the staff needs to go over 20 miles, it's better, it's more cost effective for them to use an agency vehicle. And if they're only going 5 or 10 miles, it's more cost effective to pay them mileage. So we'll do that, that cost analysis with the caseloads that staff have. And again, under consideration of where the staff is starting from, the availability of an agency vehicle, the productivity that we're looking at for that staff, and then most of all, making sure we're able to get to all the folks that we're providing services to. So, but that is one of the cost analysis that we will do with each staff based on their caseload, that has helped us to cut some costs and be more cost effective for the program. Next slide, please, Eric. All right, some challenges along the way. These are a couple of them. We've kind of talked about how we've addressed some of them, and we continue to kind of look for other ways to work through them. But some of our biggest challenges are the no calls, no shows. We have they're scheduled, the staff go out, so we have costs of the staff, we have costs of the travel. They show up and the individual's not there, or they let us know that we're not able to participate in the session today. So the no call, no shows are an ongoing challenge that we look at to try to come up with some creative ways to address. The weather winter that we have here in New York sometimes create some difficulties with the snow and ice. We have to sometimes adjust some service provision based on the snow and the ice that we get. So that's just an ongoing factor that is a challenge that we continue to just monitor and try to come up with creative ways. And sometimes it's based, we narrow it down to specifically what the family needs. Some families might need a phone call the day before the session, and so we'll just need to give them a phone call, verify that it's on their schedule, verify that they're participating in it, and that just helps them with, helps to decrease the no-call, no-shows. We can actually utilize that within their service provision and their goals on scheduling and being and keeping track of their appointments and things like that. But that definitely is one of the challenges that is an ongoing factor that we look at and try to address in different creative ways. Staffing in the rural counties, probably in any county across the state, is a challenge, and it's something we continue to work on, different ideas, brainstorm, different places to reach out to. Another factor that comes in is the importance of the interview in getting a qualified staff for a community service. Community services aren't for everybody. Some staff do well being able to get a schedule, go out into the community and do the job that is community habilitation. We have found that other staff, other DSPs, they do better when they're in a site-based program, so they have other people around them to be there as part of the team and have that oversight and that ability to bounce ideas off of other people in the moment. So that's something that we try to do with the interview process, is kind of feel out what area that staff might do better in, because yes, some community services, sending them out on their own to go meet with people just isn't everybody's cup of tea. So we try to assess that and look at that at the interview. And I think that's something that we have done that's helped with our staff retention, but it definitely is an ongoing factor that is a challenge, and we pay attention to. It's on our list to pay attention to. And again, the other part is covering. We have a huge catchment area because we're in a rural county, so covering the service provision, having the staffing to cover the entire catchment area is definitely an ongoing challenge. So that's, again, just something when we're hiring staff, when we're working with our HR department, we have those conversations of what the program needs, what we're looking for in staff, what that entails. So those are definitely some of the main ongoing challenges that we are looking at and continue to have dialogue about for the ComHab program. Next slide, please, Eric. All right, some lessons learned. And we had to change our employment status flexibility. At first, we attempted to do just a part-time employment status for the ComHab program. We started doing that and found that we had even more difficulty getting and retaining staff. So we have offered that flexibility. We have some part-time opportunities as well as full-time with benefits. And again, that's just something we worked on with our fiscal analyst to say, you know, if we have full-time with benefits, what's that program cost operationally, and then, you know, looking at the units provided to make sure that we budgeted for that adjustment and that change. But that flexibility in providing that for staff has helped in our staff retention. We are very careful not to do overtime. So, and again, that's something that having the staff specific caseloads and schedules up front helps us to monitor that overtime piece. So we really work closely. If there's any overtime at all, it has to be previously approved by the supervisor so that they know what the situation is, what's going on. But we really do strive to stay within the schedules for the individuals as well as the staff for that consistency with the program. Setting the expectations for documentation. the timelines for the documentation, the mileage, and use of agency vehicles. So whatever we have set up with that staff, we really hold them accountable to it, and have ongoing discussions of what's working. And then when their caseload changes, we have a discussion about, you know, all the impact of that has on, you know, does that change their mileage? Does that change their the direction of travel? Does it, we know what impact is that going to have on the factors that we've discussed here today? So it's just having that dialogue up front has really helped hold staff accountable. It's helped to meet the expectations of the program. It's helped with the consistency. I think the consistency for staff is very beneficial. It helps staff with their time management, being a community program and them going out into the community. I think setting these expectations, having them set up right off the bat, really helps with some of that time management piece and holding staff accountable to meet them. We do try to match the individual with appropriate staff, and maximizing that engagement with the service. So I mean, that's something we balance with. We don't, just because they're going to a specific location, if the individual actually needs a different staff, we look at the next closest staff that would meet the need for the engagement of what that individual needs. We have ongoing discussion about community resources across the county in our staff meetings. It's a constant dialogue of, there's a new community service available. If a staff makes any connections with additional community resources, we have that discussion of what that looks like. If there's unfortunately a community resource that goes away, we have that discussion. So it really keeps the staff, the program staff, really current on what community resources are available. And again, that goes into that discussion of the opportunities that the community habilitation program can provide to individuals, and piggybacks on that piece of ownership that we really try to have dialogue about for the individual and the staff. So the ever-changing resources across the county, we have ongoing conversations with staff, with individuals to stay as current as possible in what the community have program and what the individuals have available to them. Documentation outside of session time. This was one of our, definitely a lesson learned. Giving staff those expectations, again, just helps with the time management. We had found at the beginning, some staff kind of struggled with some of that time management and weren't always getting the documentation done, the daily notes in a reasonable time. So we would set, you know, a time frame. They would struggle with getting some of them done because time management of doing that documentation separate from the actual service provision. Some of them struggled with that. So that's shifting it to doing it at the end of session really, really helped with that. Also, when they did the documentation out of session, if they met with a couple people during the day and did the notes later in the day, they tended to not be as person-centered. I mean, they were still good, but they tended to veer away from the person-centered because they were done later outside of the time the staff was actually with the person. So that's just something we noticed when we flipped the documentation to being done with the person. It definitely became more person-centered. The staff get them in on time more consistently. And like I said, we're able to right off the bat, if a staff doesn't get their daily notes in and their documentation in, each week we're calling out to them and saying, you know, what's going on, what's happening, and we're right on it, rather than waiting till a month later and then realizing it's not there, or realizing it was late, or that there's an issue. So that's something we keep a real close eye on it. So I mean, that's kind of the nuts and bolts of some of the things that we have learned and we have put in place to really maintain some consistency, really watch the budgeted units of the revenue of the program versus the operational costs, and keeping an eye on that and making any necessary adjustments. These really are some of the factors that help keep the ComHab program to be fiscally sustainable. So these are factors that we're constantly monitoring and having discussion about as the leadership team, to look at and make any adjustments that are necessary. So it's an ongoing monitoring process in the program operational day-to-day operations. So and we're continuing to brainstorm some of these challenges, and anything new that comes at us, we continue to brainstorm to see what adjustments we need to make, constantly trying to learn different ways that we can work through the challenges, program-wise, service-wise, operationally, to continue to provide this a quality service and continue to keep it fiscally sustainable. So it's definitely an ongoing process that we work on to maintain what the ComHab program is here at In Tandem. So I mean, that's the overview. I'm going to send it back to you, Eric, if there are any questions. Our Mary Ellen and my contact information is there on the last slide. If you'd like to reach out, feel free to. So yeah, if there are any questions, Eric, we'd be happy to try to answer them.
There's a bunch of them, so we'll kind of take them one at a time. Before we get into the questions, that people can reach out directly to you guys?
Sure. Yeah.
Okay.
Yep.
All right, great, because some of the questions get pretty technical. I'm not sure we're going to get to all of them, but let me start throwing them out to you, and we'll try to get through as many as we can in the remaining 15 to 20 minutes. So kind of a high-level question. How many people do you guys serve through Community Hab?
For Community Hab, we have about 75, and then we also provide services to some of our ComHab R folks, and we have about 30 of those individuals.
So all combined about 100?
Yep.
Okay.
A little over 100, yep.
Okay. From earlier in the presentation, with monitoring the units that you guys mentioned, do you do that manually, or do you have some sort of software or program to do it?
Well, that's a good question. Right now, we do it manually with our fiscal analysts. The billing that we send in to them, we pull the data out of the information that we sent. We are working on heading into our EHR process, and once we get there, we can do some, hopefully shift it over to do some, use our EHR. But right now, we do a lot of it manually.
Okay.
Go ahead, Mary Ellen. Mary Ellen wants to add to that.
We have a setup where we call the proof of service, and each individual's name is listed. And each week, that's why we check the notes and everything on a weekly basis. We input the units that each individual has, received for the week. And that way, as we go through it, it's set up, our analysts set it up for us. So until we have, until we're able to get into our program, this is what we do. Yeah. But it's done on a weekly basis, so that way we can, see where we're at.
So it really does streamline the billable services we're providing each week, and then we just add to that the form that our fiscal analyst gave us, and then at the end of the month we then get some monthly data as well, and then we work with the fiscal analyst to see what adjustments might be needed.
Okay, next question. What are your staff retention rates? I guess I'm assuming within the Community Hab program. And has that changed at all since you've implemented the process that you outlined?
I am not sure of our exact retention rate for the ComHab program. I would have to check with our HR program. So I'm not sure of the exact, but it has improved since we've implemented some of these specific factors for scheduling and case loading.
We've also been fortunate that we've had staff here for over 20 years who are doing, started out with the program from the onset, and we're just lucky in that way, and people enjoy going out to the community, working one-on-one with individuals. I think that's a big draw too.
Okay. All right. Your service documentation, is that all done via paper or is that done electronically?
Yes, right now it's done via paper. And that's, that helps with that process of doing it with the individual. Looking down the road and the technology available, that might change in the future, but we still want to be able to for staff to have the technology to do it in the session with the individual, for the reasons that were stated. But right now we do use paper.
Okay. Okay. How do you deal with staff schedules when an individual cancels a trip? So in other words, how would staff time be made up?
What we look at is if an individual has a session on a Monday and they have to cancel because they're going away or something, we try to do makeup visits. And the makeup visits are done within the week when the person is off. It may even be on a Saturday if the individual and the family is willing. Or what we also do is sometimes people have 2 days a week. What we'll do is add an extra time, if possible, to their session. Unfortunately, if a staff doesn't work, if they can't make it up with somebody else, it affects their pay. But most of the time, and I'm saying probably a lot of the time, we do makeup visits.
Okay, great. This is an interesting one. The ComHab staff, in terms of insurance coverage for their vehicles, do you have specific requirements? Do you require that they carry insurance above New York State minimum insurance requirements? And if yes, do you compensate them for the difference in cost?
Oh boy.
Yeah. Well, from our HR department, we do require that they carry the minimum New York State insurance, and then the staff register that through the HR department. We don't compensate them because the mileage compensation includes that insurance coverage piece. So if you look at the federal mileage, what is included in that cost and in that payment, that includes that insurance piece. So that's what we do with their insurance.
And we also have a pretty good fleet of cars where a lot of staff, especially traveling distances, are able to use an agency vehicle, and they are insured.
Okay, excellent. This is an interesting one. As you know, ComHab is one of the two programs that is going to be or fall into the EVV requirements. Are you guys thinking about that or planning for that?
Yes, we are. I've had some meetings with our EHR folks and our corporate compliance, and that's where I'm talking some of the technology that we're looking at to see what's available and what we're going to do. But yeah, we are actively planning for that and seeing how that's going to impact operational costs, being able to do the documentation with the folks. These factors that I talked about are some of the main things we're looking at wanting to maintain. So we are in discussion about that and planning for it.
Okay. This is a kind of a counterpoint question to when an individual cancels. What do you do when a staff member cancels or is a no-show?
Again, we'll, if for some reason a staff is sick, an emergency arises or something, what we do is we do a makeup visit with the individual to ensure they're getting the time that they need. On some occasions, we have another staff member who may also know the people, and we may get a sub to go in and take over for them. If we know ahead of time, we definitely provide other staffing to go in. if it's an emergency type situation or it's short notice, sometimes we'll have to work on a makeup visit.
All right. And your average caseload for staff?
Most have between 5 and 8 people a week. Some have 10.
Okay.
I mean, depending on the, their hours and if they're full or part-time.
Okay. How about do you focus on one-to-one, or do you do more in group sessions?
Well, the idea is one-on-one. However, we do group sessions. We work up to with no more than 3 individuals per staff. However, what we are finding out, and has also helped us to keep things going, is that we'll have a couple staff get together when there is some kind of special event going on. And so there'll be maybe 3 staff and they'll bring their individuals, and that way there's that socialization for the other individuals. And we can, still have our one-on-one, but yet kind of like in a group situation.
Okay. How about the equipment for staff? Do you utilize technology, iPads, laptops? Are those provided by the agency?
At this time, we don't. They use paper daily note to write in. That, again, is something that we are in discussion about, depending on the EVV requirements. We're working with our IT and leadership team to figure out what's going to be most appropriate. Looking at GPS, how that factors in with the EVV. Do we do laptops or tablets? We're headed that way for the technology that's needed, but we're not there yet. Right now, they have just the paper.
Okay. What, let's see, have you set minimum service times that must be met? For instance, service time blocks must be at least 2 hours to balance the cost of the program.
Well, for it to actually benefit an individual, 2 hours is usually our minimum. We go up to 4 hours for some individuals, and there's been times, depending on what the situation is, we may add an hour or two if it's something special going on that they want to be involved in, and we work it out. But minimally, we do 2 hours per session.
Okay. Let me just scroll through and see. There's all right, here's an interesting one. Is a fiscal analyst part of the financial department, or is it just additional staff for the ComHab department?
For our agent, it's part of the fiscal department.
Accounting.
Yeah, our accounting department.
Right. And do you have a policy and procedure that outlines the operation of the ComHab program? And if so, would you be willing to share it?
Well, I guess that we have several procedures that outline them. We would be happy to have a discussion with, whoever presented that question. We would be happy to have a discussion with them around that.
They
Okay.
can email us.
Yeah.
Yes, we may email on their behalf, but we'll connect with you guys and Mary and see if that's possible. In terms of the financial viability of the program, do you know if the ComHab program makes money, break even, loses money? How does it do?
We do well. We make money. Yeah, we come in at a profit.
A small. Profit.
Small profit.
That's not the purpose of the program, but it helps to keep us sustainable.
We do.
Okay.
We don't have a deficit in the ComHab program.
No.
And how about productivity goals for staff?
It's based on their caseload. That's where we set up their caseload, and then the billable time versus their hours worked determines that productivity. So.
Okay. How much admin, non-billable, do you have in the ComHab department?
That was, I'm not sure of that information.
And are you talking about administrative costs?
Yes. Yep.
I'm not,
Oh,
I'm not sure of that information.
We're not privy to that.
Okay.
We don't know.
I get it. That's fine. How about assessing whether the individuals you serve are happy with the ComHab program and the activities that they're engaging in?
We do satisfaction surveys for each of our programs. So twice a year, we'll send out a satisfaction survey, and there we encourage them to provide us any feedback that they have, and the questions outline, what give us kind of an idea of their satisfaction with the service. We also encourage them, if they need to call, they can call the supervisor of the program directly. If they have an issue, families can call. We really do try to keep that engagement and that collaboration with individuals and families, so that if they have any concerns, that they are free to call.
And also, every 6 months we do our life plans and everything like that. So everything is brought up then if they want changes, and we make them at that point in time too.
What if anything has changed with your ComHab program since the onset of COVID?
Oh boy.
For telehealth.
We're doing telehealth. It has been, it's been, yeah, that's a challenge. A huge challenge. We've been doing telehealth with the folks that are able to. We've been in contact with families. If we have individuals that aren't able to engage in the telehealth or the telephonic, we're trying to at least touch base with them to see how they're doing. We are working on a plan to head back towards some face-to-face. We're collaborating with other services to see if to get at least one service in there if they have multiple services. So to get at least one service in there to provide as much support as we can, but also awareness of the high-risk population and the risk of exposure. We definitely are making that a priority and want to keep everybody safe. We have also developed a bus that we're hoping to get that bus going. I believe it's getting ready to go so that we can actually take this bus. We have all the precautions in place, take it out and meet with some of the folks on this bus to do some community HAB services.
Okay. All right. I think we have time for one more. There's a few additional questions, but really we're getting towards the end of the time now. How do you guys match up a particular ComHab staff worker with a service recipient? Is there any sort of evaluation, or how do you make sure you're making the right connection between staff and individual?
Well, before it all gets started, we get the life plans and we get introduced to the individual, and we kind of learn, the things that they like and need. And from that, we'll take a staff that we feel would best, help the person along the way. It doesn't always work out, but most of the time it does. We try to match a staff with an individual we know. Sometimes they'll make a specific request. They might know somebody, or they might prefer a male to a female, whatever. And so we listen to what their needs are, and then we try to make sure that we have a staff that we know could help provide that for them.
Okay, wonderful. I have a couple of answers. Mary has been texting me, so a couple of clarifications to the questions. In terms of administrative overhead, Mary indicates that it's about 8%, and she would be willing to share the policies and procedures. So that's great. What I'll do is I'll connect with both of you and Mary and get those. And when we send out the recording and the slide deck, we will also send out the sample policies and procedures. So it'll be in one nice package for all of the chapters. It is almost 1 o'clock, so I want to thank Amy and Mary Ellen so much for your time. If the number of questions are any indication of whether the people enjoyed this, it looks like it was a smash success because they're still coming in. So thank you guys. Great job. And we will get this material out to the chapters as soon as we can.
Okay, great. Thank you so much.
Thank you.
Thank you.
Happy 4th.